All right. Hello, everybody. Dr. Rapich here from Vet Triage. It is November 19, Tuesday, 2:19 p.m. Pacific time. We are going through this issue of veterinary surgery, and we're going to talk about this paper here out of Davis and Cornell, Craniomaxillofacial Abnormalities in Dogs with Congenital Palatal Defects, a CT findings. And there's going to be a lot of anatomic terms in here that are related to the complexity of the canine skull. I can't show you those things, but it suffices to say that the main point of this journal will be evident. This is a pretty straightforward study. The objective is to evaluate craniomaxillofacial abnormalities in dogs with congenital palatal defects. It's retrospective. It has 9 dogs. Cases were between 1995 and 2012. Cleft palate, any dog with a cleft palate that had a CT study done. Results, tympanic bullae were most commonly found to be abnormal. That was 8 out of 9 dogs, followed by nasal turbinates, 6 dogs, nasal septum, vomer, and cribriform plate, 4 dogs, frontal sinus and lateral ventricles, 3 dogs. Other abnormalities include occlusion, so that's the teeth touching each other when you close your mouth. The teeth themselves, incisive bones, maxillary bones, mandibles, hyoid apparatus, cranial bones, nasopharynx. The soft tissue defect of the cleft was always smaller than the bone defect, and this may be important for surgical planning. The soft tissue component of the cleft may underestimate the extent of the bony defect, especially in failed repairs of palatal disease. So, introduction. The incisive bones result from fusion of the paired medial nasal processes. Maxillary processes in the dogs fuse at midline to produce most of the upper lip. Nasal processes fuse with the maxillary processes beginning at the palatine fissures to form the upper lip, alveolar process, and primary palate as occurs in people. The alveolar process forms through the fusion of the bilateral maxillo-incisive suture lines, followed by closure of the rostral aspect of the nose and the upper lip. Then the secondary palate, which makes up 90% of the hard and soft palates, is formed from the maxillary processes after fusion of the palatal processes of the maxillae with the incisive bone, and then with each other and with the vomer. The soft palate forms afterwards. The exact location of the boundary between the primary and secondary palate is controversial, and definitions and classifications of oral clefts may vary in people and in dogs. A cleft palate involves the structures of the secondary palate and may be an isolated defect or might be associated with a cleft lip, which is a defect involving the structure of the primary palate. Minor degrees of velar asymmetry are not uncommon in pets and patients with cleft lip, cleft palate, or both, and more severe degrees of velopharyngeal asymmetry may be present in patients with hemifacial microsomia. However, gross unilateral hypoplasia of the velum and pharynx in patients with no significant hemifacial microsomia or facial asymmetry is rare and probably a separate entity in people. Unilateral congenital soft palate hypoplasia is also rare in dogs, and its development is unknown. Cleft palate is one of the most common major congenital defects in people, with a prevalence varying from 1.5 to 3.2 per 1,000 births. In veterinary medicine, the occurrence of cleft lip and cleft palate seems to be less common, with 1.1 per 1,000 cases in beagles that are bred with a pure strain. The precise cause of congenital palatal defects and velopharyngeal hypoplasia is not entirely understood, and several genetic and environmental factors are involved. 2/3 or more of facial clefts in people are isolated anomalies called non-syndromatic clefts. However, over 350 developmental syndromes associated with cleft lip and cleft palate have been identified. So you can already tell the anatomy here is going to be crazy. But for vet students, if you want to pull out a skull and then pause the video, and you can get a better depiction of the anatomy behind this. Okay. Procedure. They classified clefts as either clefts of the primary palate, which are rostral to the incisive foramen and involving the lip, and isolated clefts of the secondary palate, which is the hard palate, caudal to the incisive foramen, and soft palate. We considered hypoplastic soft palate as a separate entity. Here's a CT scan there, if I can show you. There you go. So you can see the arrowheads. That's the cleft palate, the soft portion. And then you can see the arrows are the bony portion. It's cleft. And this patient also has abnormalities in the nasal turbinates and that right frontal sinus. I'm going to show you all the way over there. Right there, this guy is malformed and small. Median age of dogs was 9 months old. Of the dogs, 4 were intact females, followed by 3 castrated males, followed by 2 spayed females, and they were all purebred. Cleft lip dogs include Cocker Spaniel, Boston Terrier, English Springer Spaniel. For cleft palate, Yorkie, Manchester Terrier, Frenchie, German wire-haired pointer, Chihuahua. Hypoplastic palate was Portuguese Water Spaniel. Cleft lip dogs were reported to occasionally sneeze. 1 dog had difficulty drinking. 2 cleft lip dogs had bilateral clefts of the primary palate and lip. 1 had a midline cleft of the primary palate and bifid nose. In hypoplastic palate or cleft palate dogs, a chronic nasal discharge was always observed, and they may have had a history of aspiration pneumonia. 1 dog had seizures, 1 had a slow menace, 1 had an intermittent hypermetric gait and interspersed circling, exophthalmos, bilateral strabismus, hydrocephaly, open fontanelle, stenonic unilateral ear canal, and malformed pinna. And blood work may show a mild inflammatory response with leukocytosis, neutrophilia, monocytosis, and high globulins. 5 of the 6 mesocephalic breeds, the Cocker Spaniel, English Springer Spaniel, Portuguese Water Spaniel, Yorkie, Manchester Terrier, and German wire-haired pointer, had relative maxillary brachynathia. Okay, CT findings. Incisive bones were abnormal in 3 of the 8 dogs, 2 hyperplastic, 1 malpositioned. Maxillary bones were abnormal. 1 had abnormal palatine fissure, bony defect of the maxilla. The nasal septum was absent or poorly developed. Hypoplastic nasal turbinates were found. Absent or cleft vomer, incomplete cribriform plate, anomalous ethmoid bone. Abnormal tympanic bullae was the most common abnormality. Tympanic bullae were bilaterally hypoplastic, meaning they were thickened. Unilateral otitis media was diagnosed on occasion, 1 dog. Anomalous frontal sinuses, displaced ventricles or ventriculomegaly, unilateral hypoplastic mandible and zygomatic arch, open parieto-occipital suture, unilaterally absent epihyoid and hypoplastic stylohyoid bones, focally missing calvarium bones, including occipital, temporal, frontal, and parietal, and enlarged nasopharynx. All of this just to tell you that there's multiple abnormalities in these dogs if you actually look. Hey, Vet Omar, thanks a lot for the great information. Hey, no problem. Let me know if you have any ideas for how to improve these live streams. Still getting started here and looking to gather more of an audience. But if you have any questions, let me know. Any suggestions, let me know. Thanks for joining, Vet Omar. All right, and then we have here this top view right there, this CT scan showing a severe gap. I mean, this dog has no palate. The soft and bony are gone, and it's missing portions of the nasal turbinates and nasal septum. And then you have a 3D reconstruction here at the bottom there. So you can see that. You can notice a dental malocclusion in this dog as well. Okay, let's see. Incisor malocclusion and number of incisor teeth were abnormal. Missing teeth, malocclusion, odontodysplasia, persistent deciduous teeth, all could be found. The surface area of the bony defect compared to the surface area of the soft tissue defect. In all dogs, the bony defect, which had a median area of 2.06 centimeters squared, was larger than the soft tissue defect at a median area of 0.31 centimeters squared. That's a very important part of this finding. The median difference of the bony and the soft was 1.75 centimeters squared. Here you can see another CT scan. Notice that the right bulla right there, the right bulla is small and thickened, and the left one is normal. Here's the left one, normal. And then here's a CT scan 3D reconstruction. You can see the massive, how am I doing this here? There we go. Massive, this midline. I can't do it. Here, let me do the other hand. There we go. Midline, huge cleft there in the skull. And then here's a real picture of a dog. Oh my goodness. Here it is. There we go. Of a cleft palate. That was difficult. Okay, discussion. All dogs had at least one craniomaxillofacial anomaly associated with congenital palatal defect. Other studies, 12 of 13 calves with palatal clefts had at least another craniomaxillofacial abnormality. Associated defects in dogs with palatal defects were previously reported to be less common, occurring only in 13.5% of dogs studied. In people, data on recurrence of associated craniomaxillofacial defects in patients with orofacial clefts vary greatly, with prevalence ranging from 25 to 47%. Cleft palate is usually reported as having the most associated defects. An association between congenital palatal defects and middle ear pathology is common in dogs. Despite the commonly observed hypoplastic bullae with thickened wall observed on skull radiographs, otitis media seems to be rare. Otitis media is rarely detected on 1 to 5 years follow-up in dogs with anomalous tympanic bullae associated with cleft palate. Now, here's where I would have a disagreement with this. I bet you, if you performed an MRI, you may see more detail regarding these structures and a higher chance of finding fluid buildup in these dogs. Maybe not, but CT scan is great for bone. It's not great for soft tissue. So I would argue maybe an MRI should be the next step here. In contrast, impaired middle ear drainage appears to be responsible for middle ear inflammation in cats. Whether or not middle ear abnormalities in dogs with congenital palatal defects are associated with eustachian tube abnormalities or dysfunction remains controversial. Nasal septum defects occurs in people with orofacial clefts and were the next most commonly affected, along with turbinates in these dogs. Several other hypoplastic and deformed bones of the craniomaxillofacial skeleton includes incisive bone, vomer, ethmoid bone. The fissure of the cranial sutures that were observed previously described in calves with palatal defects. Skeletal malocclusion, meaning relative maxillary brachionathia, has been reported in association with congenital palatal defects in dogs and calves and in people. Although ventricular asymmetry has been described as a common clinically unimportant finding in some dog breeds, in people, cerebral lateral ventricular asymmetry, particularly severe asymmetry or diffuse ventricular enlargement without obvious cause noted on CT, was further related to important clinical findings and brain structure anomalies. In an anatomic study of dogs with palatal clefts, internal hydrocephalus occurred in a similar proportion, 33% of dogs with palatal clefts. Hydrocephalus reported in 4.7% of dogs with palatal clefts. Meningocele in a puppy with a cleft palate has been reported. Brain anomalies were reported in 3 of 13 calves with palatal defects. So maybe when we find ventricular asymmetry in dogs, especially brachycephalics, that's the most common on MRI, we shouldn't just say that no problem there. There might be actual disease associated with it, even though I do see it as a breed anomaly without any clinical significance. In people, central nervous system malformation is reported as one of the most common malformations in patients with oral clefts. Dental anomalies, especially those related to incisor teeth, are considered to maintain the proportional trend according to the severity of cleft in people. The soft tissue defect in dogs with palatal clefts was always smaller than the bony defect, which is of importance with surgery, creating flaps that are free of tension at the suture lines, appropriate size, appropriate configuration, and in relation to the defect size, shape, and location, and have underlying bony support at the suture lines, among other factors, increased chance of success. That's what makes these surgeries so difficult. Evaluation of the defect by advanced imaging, such as CT, should be recommended for any surgical intervention is done. Although previous studies have shown the frequency of oral clefts in people and dogs were similar, we found only 17 cases presented to this veterinary hospital, which admits typically 17,600 dogs per year, which is 450 per year to the dentistry and oral surgery group over a 16-year time. These findings are in contrast with reports in human medicine, where 20 to 44 patients with cleft palates were recorded per year in a 25-year study, including 334,000 births, giving the birth prevalence of oral clefts 19.5 in 10,000 in human beings. Isolated cleft palate occurs in 6 of 17 dogs, excluding the hypoplastic palate case, and cleft palate is reported to occur in 30 to 47% of human patients. However, in this study, all cleft lip cases were limited to the primary palate and lip, with a bifid nose occurring in one dog, whereas in people, cleft lip and cleft palate were reported to frequently occur together. In dogs, reported ranges from 1 to 18, or 5.5%, to 26 of 35 dogs, or 74.3%. Also, cleft lip associated or not with cleft palate seems to be a different entity than isolated cleft palate in people, whereas in dogs, cleft palate does not seem to be genetically distinct from cleft lip, associated or not with cleft palate. So there you go. That's the study there. Hopefully you found it useful. Thanks for those watching in the playback. Thank you, Vet Omar, for joining this stream. Hopefully we'll get more live audience members as time goes on. And I'll be back again tomorrow for another one. I think tomorrow's will be another palates research. So excited to continue that trend. Take care, everybody. Bye.